Hi everyone, my name is Dr. Frankie and I am the Health Expert Ambassador for FemFresh. In this video, we're going to be talking about vulvodynia. Everything may look normal down below, but as many as 1 in 10 women are experiencing vulvodynia, which is a persistent and unexplained pain in the vagina and vulval area. It can feel like a sore, burning or throbbing pain and may be exacerbated by touch, such as washing, getting dressed, exercise or sex. The cause of vulvodynia is largely unknown, but it's thought to be due to a hypersensitivity of pain receptors in the vagina and the vulva. This could be caused by surgery, childbirth, a trapped nerve, but often in most cases, the cause is unknown, and that can be really frustrating for women because it really has a massive impact on their daily life. It's really important that we have conversations about topics like this because lots of women are suffering in silence. And in this video, I'm going to share my tips for how you can deal with vulvodynia and where to go if you think you are experiencing these symptoms. Tip number 1 is to avoid any irritants to that area. So when you're washing, make sure you avoid anything like harsh, fragrant soaps and instead be more gentle and use warm water. If you do prefer to use a wash, then make sure you use a pH balance wash to make sure you don't cause any further irritation. Something like the FemFresh Soothing Wash, which is pH balanced, gynecologically tested and dermatologically tested, is not going to irritate the area further if you are feeling hypersensitivity. And it's also enriched with cranberry extract, which makes it even more hydrating and soothing. Avoid wearing tight clothing like tight underwear or lycra that's going to irritate the area, and opt for wearing breathable cotton underwear and looser clothing. Avoid wearing underwear at night because that can cause further irritation. Focus on reducing stress in your life in general. We know that stress is linked to vulvodynia, so minimizing stress wherever you can in your life, I know easier said than done, could have a beneficial impact on your vulvodynia symptoms. Tips for reducing stress include practicing mindfulness, using things like meditation apps, making sure you get 8 hours of good quality sleep, that is a huge one for reduction of stress, and regular exercise. And of course, consulting your doctor if you are feeling stress is negatively impacting your life. When it comes to sex, many women unfortunately avoid being intimate because of the flare in their symptoms. They find it uncomfortable, they find it distressing, and they can find it difficult to talk to their partner about. The recommendations are to not necessarily avoid sex completely, but to communicate your symptoms and your worries with your partner to help reduce your anxiety and take things at your own pace. And some women actually report benefits from using a topical anesthetic or lubricating gel about 20 minutes before they have sex to make things less uncomfortable. And pelvic floor exercises can be really useful. They can help relax the muscles and reduce any tension or discomfort in that area. It's also really important to make sure that your symptoms aren't due to something else like a urinary tract infection or a sexually transmitted infection, because sometimes the symptoms can overlap. So you want to make sure those are excluded first before you diagnose yourself with vulvodynia. But I would urge you to go to your doctors. Unfortunately, there's no definitive cure for vulvodynia, but there are things that your doctor can do, direct you to appropriate support services. Some women benefit from things like cognitive behavioural therapy. Some women actually benefit from antidepressants, and not for their antidepressant effect, but because some of these medications can also work as painkillers. We call them neuropathic painkillers. Neuropathic pain is pain caused by hypersensitivity of nerve endings, so it's worth chatting to your doctor about those. Living with vulvodynia can be painful, it can be really emotionally challenging, and it can feel really isolating and affect relationships. So I really would urge you to seek out support if you are experiencing these symptoms. There are some really great support networks as well, such as the Vulval Pain Society, which I will link in my stories. I hope you found that quick overview on vulvodynia useful. My name's Dr. Frankie and I will see you in the next video. Bye now.